Hello, everyone. Very good morning. I am Dr. Maan Al Marzouk from Faculty of Dentistry at Massa University. I'm the coordinator for the webinars at the Faculty of Dentistry. I'll welcome all of you for another webinar from the webinar series conducted by our faculty. Today webinars is about navigating the benefit and myth about fluoride in dentistry, which is a very interesting topic for the dental practitioners, for dental students, and also for the other people of the community. Please let me introduce our moderator for the webinar, Prof. Datin Dr. Rashida Isa. Prof. Datin Dr. Rashida is currently a professor in dental public health at the Faculty of Dentistry in Massa University. She is a consultant in dental public health, and she served in national committees, including as a president of Malaysian Association of Dental Public Health Specialists from 2016 to 2018. Prof. Datin Rashida's previous tenure at University Malaya, she served as a researcher, lecturer, professor, and mentor to undergraduate and postgraduate students and earned several accolades. Please, Prof. Datin Rashida. Thank you so much for moderating the session.
Yeah, thank you, Dr. Maan, for that kind introduction. I'll just say a little bit about the topic that we are discussing today. As we all know, fluoride has long been acknowledged as a powerful tool in preventing tooth decay. However, it has been a subject of controversies and misconceptions. So in this webinar, our speaker will provide an overview of fluoride in dentistry, separating fact from fiction and shedding light on the latest research and evidence-based practices. She will discuss the proven benefits of fluorides in preventing tooth decay, its role in promoting oral health across different age groups. In addition, she will also address common myths and misconceptions surrounding fluoride. Please welcome our speaker, Associate Professor Dr. Noor Azlida Muhammad Noor. I will introduce our speaker. Dr. Noor Azlida is an associate professor and a registered dental public health specialist working at the Faculty of Dentistry, University of Malaya. She worked with the Ministry of Health for over 2 years and joined UM as a trainee lecturer in 2010. She obtained her master's degree in dental public health from Queen's Mary University of London in 2011 and was also awarded the diploma in dental public health from the Royal College of Surgeons in the same year. She obtained her PhD at Cardiff University in 2018, and her PhD research project was evaluating the impact of water fluoridation on oral health, and it has won the prestigious Roger Anderson Prize from the British Association for the Study of Community Dentistry. She teaches and supervises undergraduate and postgraduate students and also involved in curriculum reviews for all the programs. She has also actively published in numerous journals and reviews manuscripts for academic journals. So she has been awarded several research, education, and innovation awards at national and international level. Dr. Azlida's main areas of interest include preventive dentistry, oral epidemiology, dental education, and health service research. She has been appointed as working committee member for the National Oral Health Plan from 2021 to 2030 and as an expert panel member to review the National Fluoride Guideline. So she also serves as consultant to evaluate the impact of oral health promotion programs by the Ministry of Health, so showcasing her commitment to improving oral health policies and programs in the country. So without further ado, it is my pleasure to invite Associate Professor Dr. Noor Azlida to present her webinar today.
Thank you so much, Professor Dati Rashida, who are also one of my mentors at University Malaya. Thank you for the kind introduction and thank you for the invitation to be part of this webinar. So today, I think I will share with all of you about benefits and myths about fluoride in dentistry. I think some of it maybe you already know, some may be a refresher to our practitioner, and there are some new evidence, especially coming from our research in Malaysia. So for the content of this presentation, I will start with what is fluoride or introduction about sources of fluoride, and then a short video about how fluoride works. So it's just, I think, a refresher to those with dental background. And but I was informed there are also maybe public joining the webinar, so maybe they can also benefit from the introduction. And then we will go into the benefits of fluoride in caries prevention and the common myth about fluoride, the use of fluoride in caries prevention, as well as how we can debunk this myth with scientific evidence. And after that, I will conclude the presentation. All right, so just a quick introduction about what is fluoride. So actually, fluorides are something naturally found. Yeah, we can obtain fluoride from our tea, daily tea, morning tea. Yeah, sometimes we all drink teas. Yeah, and also from fish, from anchovies, from rocks. Yeah, sometimes we have what we call naturally fluoride found in the water. Yeah, some area even in our country there are naturally present fluoride. So the keywords here is actually a natural source. Yeah. So and then it's a proven effective public health measure to caries prevention worldwide. So it's not just in our country, but it's been proven and being used extensively worldwide. So in terms of presence of fluoride from dental products, we can get it from toothpaste, yeah, mouthwash, and professionally applied, for example, like fluoride varnish. So I will go a bit more details on this later. But before I go deeper, maybe I would like to all of us to watch this video from American Dental Association about how fluoride actually works in caries prevention. So let's watch this video. Yeah, I will try to. Oops.
Everyone's heard of fluoride, but what exactly is it and how does it work to prevent cavities? Fluoride is actually found naturally in rocks, soil, and water. It's a chemical ion of the element fluorine, the 13th most abundant element in the Earth's crust. An ion is a positively or negatively charged atom that helps elements combine with each other. Fluoride is a negatively charged ion that doesn't normally exist by itself. Instead, it combines with positively charged ions like sodium to make some of the ingredients that are found in your toothpaste. When these fluoride compounds are in your mouth, they can actually make your teeth stronger and prevent cavities. Fluoride is in most community water systems as well as some mouth rinses, and your dentist can apply it to your teeth in the dental office too. No matter what the source is, fluoride does the same thing to help prevent cavities. It can even reverse early tooth decay. Here's the science behind how fluoride works to fight cavities. Tooth enamel, the outer covering of your teeth that's stronger than bone, is made up of a compound called hydroxyapatite. The main minerals in hydroxyapatite are calcium and phosphate. Your spit or saliva is loaded with calcium and phosphate and bathes the teeth to keep them strong. But each time you eat carbohydrates like candy or noodles, bacteria in your mouth also eat and produce acids that attack the enamel. In this process, calcium and phosphate minerals are lost from the tooth enamel. That's demineralization, making it more likely to decay and form cavities. Fortunately, another process is also happening. Once the acid attack slows down, the calcium and the phosphate in the saliva go back into the enamel in a process called remineralization. It's a constant seesaw battle. Cavities start when there's more demineralization than remineralization. Fluoride is very important in this battle. When fluoride is in your mouth, it actually gets into the enamel through the remineralization process and forms a new super cavity-fighting compound called fluoroapatite. Fluoroapatite is much stronger and resists decay much better than hydroxyapatite. So now that you know the science inside your mouth, be sure to brush your teeth twice a day with a fluoride toothpaste that has the ADA seal of acceptance, and drink water with fluoride in it too. If you have any questions about your fluoride needs, be sure to ask your dentist. For the ADA's Science Inside, I'm Dr. Jane Gillette.
All right, I think I hope you all able to watch the video, a short video just now. So this slide, I think, a summary of what how fluoride works actually in caries prevention. So I think from the video presentation just now, I think you can get the idea that when we eat, the bacteria in our mouth create acid. So this acid actually some sort of like, try to eat our enamels, try to break down the animals that will cause cavity, or this process called demineralization. So when this continuous attack happens, so there will be enamel breakdowns, or we call cavity happen. So but when we have fluoride, so fluoride is like the superhero in our mouth. So fluoride protect our teeth. So it's involved in the battle of putting back the minerals to the to our teeth. So when fluoride present, the lost minerals are replaced with fluoride, and the enamels is repaired. So that's why it's we call this remineralization. So that's why it's very important for us to have fluoride, for caries prevention. So in terms of administration of fluoride, so there are two ways. One is systemic, something that we take or we ingest orally. For example, taking water fluoridation. So that's called systemic. So I put these several examples of systemic fluoride, but the one that we have in Malaysia is only water fluoridation. So for milk fluoridation is quite popular in countries like Switzerland, and also Mexico, Hungary, and few other countries. Sorry, that one is salt fluoridation. Salt fluoridation is more popular in Switzerland. Milk fluoridation is more in a country like United Kingdom, because there are only small area in UK that have water fluoridation. And another systemic administration of fluoride is fluoride tablet, but it become less popular now. I think more and more countries no longer actually use a fluoride tablet. But most countries, depending on their fluoride policy or national fluoride policy, usually they only opt for one systemic fluoride. So, and then they have topical fluoride. So the most common one is fluoridated toothpaste. Majority of the country worldwide are using fluoridated toothpaste. And another topical exposure would be coming from fluoridated mouthwash, and also fluoride varnish, or something that applied by a dentist. Or nowadays we also have new approach called silver diamine fluoride, but this one more on caries treatment. All right. So based on evidence, we know that fluoride toothpaste is one of the, I would say, the most powerful tool in caries prevention, because there are countries other countries who did not have water fluoridation as part of their national policy, but they have a very strong fluoridated toothpaste program. So caries, based on evidence, including Cochrane review, indicated that caries reduction in the past 30 years contributed or attributed by the widespread use of fluoridated toothpaste. And generally, it can reduce caries incident by 30%. And then the recommended concentration, we look at several guidelines later after, in the next few slides, but the range is between 1,000 to 1,500 parts per million. All right, so there are many advantages of using fluoride toothpaste. First, of course, it's convenient. You can just apply it and use it. And then culturally approved, so many society worldwide actually more open for fluoridated toothpaste approach, and it's practical and relatively cheap. I think nowadays with all these e-commerce platform, you can get exposed to a lot of fluoridated toothpaste at a cheaper price. So you have option actually. So depending on, you don't have to rely on a brand, as long as you read the label properly, look at the concentration, the ingredients. If it's have fluoride, actually you can use it no matter any brand. And also some sort of like freedom of choice, so you have a choice to choose type of toothpaste that you want, but make sure it's a fluoridated toothpaste. So another approach which I today my slide or my presentation is very much focused on the two components, fluoridated toothpaste and water fluoridation, which is commonly used as public health measure in caries prevention in our country. So in terms of water fluoridation, so this is actually a bit more controversial compared to a fluoridated toothpaste approach. Yeah. So based on evidence, actually, water fluoridation is very effective in caries prevention, and it reach out to all groups. You know, if you drink water, everybody who have access to the water can have exposure to water fluoridated. Water fluoridation. And then it's safe, yeah, and then little manpower required. So for example, if it's a toothpaste, the difference would be you have to go buy and then use it. But if it's water, it's actually, you don't require much of compliance because we actually take fluoride, water daily, right? And then the next question that commonly argued or asked by public or by anti-fluoridation group is there was question as like, then why we need to fluoridate our water if we already have a fluoridated toothpaste? So this one I will address in the next slide, but the common statement that we will argue would be based on evidence. If we have a combination of effort, which is fluoridated toothpaste plus exposure to water fluoridation, it gives a maximum protection. Yeah, it leads to higher caries reduction rate. So we will see some of the evidence later in the next slide. Yeah, because evidence has shown that water fluoridation can actually help prevent caries in both primary and permanent dentition. Yeah, so let's look at some of the evidence later. So in terms of concentration, our country is a bit unique. We are among the country, I think only 3 countries in the world, Malaysia, Hong Kong, and Singapore, that opt for the lowest concentration range by WHO. Yeah, so WHO recommendation is between 0.5 to 1.5 parts per million. So depending on the country, exposure to fluoride and other national policies. So this is a range given, and also issue related to tropical climates, yeah, where you live, yeah. So there are assumptions that when you live in a more hotter country or like us, yeah, tropical country, we may drink more water. So that's why there are movement towards a lower range, yeah. So our country also opt for 0.5 plus minus 0.1, yeah. All right, so a bit of history of water fluoridation in Malaysia, because later I will show some evidence on what happened to the state that have stopped water fluoridation. So basically, we started a national water fluoridation program in 1974, yeah, after 1972, after cabinet approval. And the first state that start water fluoridation is Johor, and followed by other states in Malaysia, and then later is implemented nationwide. But there are few things happen in between. Yeah, initially we start at 0.7 parts per million, and in 2005 the concentration has been reduced to 0.5, and it shows, yeah, the government efforts and the Ministry of Health efforts towards monitoring water fluoridation impact to the population. And also we can see there are a few states, yeah, in Kelantan, Terengganu, Pahang, whereby there's an issue of discontinuation of water fluoridation. But however, in Terengganu, they have reinstated the water fluoridation program in 2008. But sadly, Pahang has discontinued in 2014, and Kelantan has not has started, but the coverage is not that high. Yeah. All right. So what happened in our country? What is the situation in our country? People were like, why we still need fluoride? Why we still need water fluoridation? So if you look at the burden of dental caries in our country, I put 2 set of data here. One among the school children, and one on the other side is among Malaysian adults. Yeah. And if you look at our national oral health survey data, among preschool, primary schools, and high school students, we can see there's still significantly higher caries prevalence. Yeah, for example, for preschool, 71.3%. So it's very high. So it's like out of 10 preschool children, 7 we have dental caries. Yeah, and then for school children, although we see for primary school children, although we see a reduction in caries prevalence over the years, but it's still considered higher compared to other countries. So for primary school, for 12 years old, around 33.3%, and for high school children, 16 years old of age, around 45.5%. Yeah. So when we look at data for adults, so adults is even more critical, I would say. Yeah. So it's like 88.9% Malaysian adults have caries experience, and then in average having 11.7 decay. Yeah. So that's very high. And then 37.9% require extraction, and another 37% require dental fillings. It's very difficult to see adults with caries free. Yeah. So we hopefully, I don't have the recent national data survey. So hopefully after Ministry of Health release the data for the recent survey, we can see how the situation for our adults population. But in general, the disease burden is still very high. And then we can see there's an association between exposure to water fluoridation and caries prevalence in Malaysia. So it's quite obvious that we can observe that state with lower water fluoridation coverage usually have higher caries prevalence. For example, we look at this graph, yeah, Sarawak, Kelantan, Sabah, Pahang with lower water fluoridation coverage, having higher caries prevalence compared to other states. Yeah, for example, in Sabah, 73.3, and in Kelantan, 62.7%. So compared to state like Pulau Pinang, KL, Selangor, yeah. So that's one of the things that we observe here in our local data. And another issue with our country is that high sugar intakes, yeah, among Malaysian population. So it's not only linked to the chronic disease like obesity, diabetes, but it's also significantly affect dental caries as well. So all these factors, yeah, lifestyle factors also affect oral health. So that's why we'll need, I would say, different measures in caries prevention so that it will maximize the benefits to our population. All right, so this is, I think, the gist of the presentation, where we're going to talk a bit about myth or misconception about caries and what is actually, how can we actually counter argue this, yeah? So some of the controversies related to the use of fluoride is either water fluoridation or fluoridated toothpaste is actually among anti-fluoride group. It's not many, yeah, there are not that many in our country, but they have their own agenda. They put forward their agenda as well and actually confuse the public. Yeah, I have my own experience going to certain communities in several states in Malaysia that they are so scared of using fluoridated toothpaste. They are like scared if it's not safe, gonna cause them, cancer, blah blah blah. So all these negative perceptions about using fluoridated toothpaste, and also issue related to water fluoridation, for example, human rights. Yeah, they're going on about issue of the right to choose, yeah, or freedom of choice, and then complexity of implementation. We know for certain states, for example, in Kelantan, they still have issues related to piping system or water quality. So it's very challenging as well to put forward agenda of water fluoridation until the solve water quality issues, yeah, in that particular state. And another big challenge would be the use of water filters among our Malaysian population. And of course, actually, water filters, based on my research and several other studies done locally, majority are coming from the high income group. Yeah, those who actually own water filters are among the high income group. So actually, the benefits of water fluoridation still very much significant for the lower income group. Yeah. All right. So whenever I see this, issue related to myth or misconception about fluoride in dentistry, I think it's also similar to other issues, yeah, in healthcare. For example, the use of vaccine. So I think we can see during COVID-19, we can also see the similar movement in our country of anti-vax group who, against the vaccine program, and then also issue with masks. Some people don't like, the mandatory mask policy during COVID, and again the similar issue that we raised about human rights and blah blah blah. So we see almost similar pattern, yeah. So by the anti-fluoride group and also anti-vax or other anti-healthcare policy program, yeah. All right. So one of the common myth about fluoride, because they are point related to fluoridated water, they are also point related to fluoride toothpaste. So we go to the most common one, yeah. So usually this is the common one. Fluoridated water does not work, yeah. No impact on tooth decay. You just need to brush. So this is the very common, yeah, especially when we try to convince water fluoridation board and also certain communities about the benefit of water fluoridation. But actually, there are numerous scientific evidence to support the positive impact of fluoride in caries prevention. So, for example, one of the key review, Cochrane review that analyzed 74 studies from different countries worldwide that show water fluoridation is effective in reducing caries for both deciduous teeth or mid teeth and also permanent teeth, yeah. So and then also we can see there are higher caries-free children in area that they were exposed to water fluoridation compared to the children who did not exposed to water fluoridation. And another common reviews in water fluoridation is actually from York Review among the UK researcher as well as Australian Review. They're also reporting the same evidence, and a more recent evidence from USA and also Australia by Slade and Spencer and as well as Doe. They are key people in fluoride research. They also reported a higher caries reduction among children who continuously exposed to water fluoridation, all right, in their countries, yeah. And then there are more and more recent evidence, because previously their challenge, the evidence is very much concentrated on children, but now there are more evidence as well put forward in relation to the benefits among adults population, yeah. For example, in Australia, they have quite a high quality study that show evidence of lower caries experience observed among young and middle-aged adults that have long-term benefits from exposing to water fluoridation. So I think you all later can go through and read this paper, yeah. And then there also another benefit is actually reduced inequalities in oral health, yeah. For example, we know that when it comes to public health approach, fluoridated toothpaste may be benefited more those with affluent backgrounds because they can afford to brush and toothpaste. But when it comes to water fluoridation, it's actually evidence to show that it support improve equity. Yeah, so everybody who have access to water can benefit from it. So that's very important. Yeah, so you don't have to buy. For example, water you use it daily. So it's actually benefit a lot of people in different pockets of deprivation. Then also there are evidence to show that poorer children, when they compare those who are all the poor children or less affluent group who live in area with water fluoridation compared to children who are less affluent but live in an area without water fluoridation, actually those who don't have exposure to water fluoridation actually again have higher caries. So that's even when they compare, the same group of children who are less affluent. So actually it's very beneficial for different groups of different backgrounds of children, different socioeconomic status. So actually it's very beneficial. And then what happened when we stop water fluoridation? So this one we can see from evidence from our country, in Malaysia. So we know that in Pahang, it was unfortunate. In 2014, they have issues, financial issues. So the water board has stopped water fluoridation in Pahang. And after several years, we have seen the data. This is from my research, my postgraduate student, Dr. Faiza, who also a specialist in the public health in Ministry of Health. So we can see that very strong evidence to show that children who are living in Pahang and not exposed to water fluoridation have higher caries experience compared to children who live in area which is continue to water fluoridation. This is after we control all the confounding factors. It's still indicated exposure to water fluoridation is actually very strongly associated with caries prevalence, and this one among caries at dentine level. And actually we see similar results when we analyze, because we use ICDAS in this research. So we also have data for early caries lesion. So similar pattern that we observe for early caries lesion. Yeah. So there are high prevalence in Pahang after water fluoridation has stopped. And then after, I think similar to the school oral health data, when we observe school children in Pahang before water fluoridation stopped and after water fluoridation stopped, we can see similar pattern. Yeah. So there's a evidence to show that caries increase, yeah, post cessation of water fluoridation in Pahang. All right. So what happened if it's, is there any other evidence from other countries related to stopping water fluoridation? Yes, there are a few countries. Yeah, this is the recent one from Canada. Yeah, in Calgary, they have published the findings in very reputable journal. Yeah, in community dentistry or epidemiology, in Journal of Epidemiology Community Health. So this is very reputable journals that publish this evidence. So even in a developed country like Canada, so they show similar evidence that caries prevalence increase after discontinuation of water fluoridation program. So I think in Canada they have both papers, one short-term evaluation, and now they just recently published on 7-year follow-up, which shows similar results. Yeah. All right. So again, when we look at the evidence for our country, this is again among children who were exposed to water fluoridation and children who live in an area that have stopped water fluoridation. Yeah, so they have partial exposure. So when we compare in terms of their oral health related quality of life among children aged 12 years old in Pahang, we can see that actually these children reported poor oral quality of life. Yeah, that is very impact. It's impact in terms of toothache, sensitive tooth, yeah, tooth decay in their mouth. So this is actually the data to show that the children are affected by the decay, by tooth decay. So we have evidence to show that children live in water fluoridation area as better or have related quality of life compared to those who actually live in area without water fluoridation. All right, so another myth that quite common is actually people will say that water fluoridation is expensive because you go through a lot of process. Yeah, I think some of our dental students or postgraduate students who have experience going to the water plantation will appreciate this. You observe how it's done at the water plantation area, how actually fluoride administered. So actually this is merely perceptions, yeah. But when we actually do the study or analyze the data, water fluoridation is cost effective. So we have recent evidence from our country, Malaysia. One of my doctorate students have analyzed this, yeah, Dr. Susan's project. So actually from her thesis, we can see that the cost per capita for water fluoridation in Perak between 2015 to 2019 is actually only 6 ringgit per person, 6 ringgit and 28 cents per person. So it's considered very cheap, right? Compared to you go and having your scaling or your teeth being restored. So actually it costs more, yeah. So, and when we analyze the cost-related treatment for dental caries in Pahang or area who has stopped water fluoridation that can cost or have service up to ringgit Malaysia 79 ringgit 43 cent, compared to when we continue water fluoridation, which is only will cost the or have service at only RM 14 ringgit and 44 cent. So it is there's a huge discrepancy, and a lot of saving can be done actually by doing water fluoridation. And then we can see evidence that water fluoridation save money by avoiding unnecessary dental treatment, for example, fillings, yeah. And then, of course, similar evidence shows in globally or in other countries. Yeah, we have a scoping review on economic evaluation of water fluoridation, and there are several systematic review as well. And then this is quite, I think, recent from Ireland, who also did a cost effectiveness analysis of water fluoridation among school children. So all papers show a significant saving, yeah, when we invest in water fluoridation. So for example, from this scoping review, the conclusion is every $1 invested in water fluoridation can save $38 in unnecessary dental costs or dental treatment. All right. So the next one, common myth that I observe, yeah, and also receive from the public or even from certain anti-fluoride group, they will argue on freedom of choice. So this one is, the argument will be both on freedom of choice for fluoridated toothpaste and freedom of choice for not using water fluoridation, you know. So actually, I will start with argument for water fluoridation first. So when we decide on water fluoridation policy, is actually we weigh on the benefit and risk to the population, and of course the principle of the decision for public health measure will definitely what we will go, what is what will benefit the entire community, not not based on certain group of individuals trying, who are fears or trying to back up their argument poorly or without any scientific basis. So that's why maintaining the water fluoridation program is based on what is healthy for the entire community, what is the best for the entire community, so that more people can benefit from it. So that's how I think the government still continue this water fluoridation program. And then another thing is issue related to if they say there's no freedom of choice, but with the current situation in Malaysia of having water filters, actually they do have choice nowadays if they are still argue on this, right? So because there are certain type of water filters like RO that can actually remove fluoride, yeah. So again, another issue related to freedom of choice for toothpaste. So this one a bit tricky because how to say it, with the higher availability of non-fluoridated toothpaste in the market, that's actually confused a lot of public actually, which one they should choose, because I've done a market survey with my undergraduate students, and we can see around 51 to 49%. So there's a lot, around 49% actually non-fluoridated toothpaste available in the market. So that can actually, and plus those in e-commerce platform as well. So that's very challenging, I would say. So, and then also confuse the public. So which one they should choose. So I think as a dentist, we always argue that there's no evidence to support the benefit of using non-fluoridated toothpaste. So we need combination of both, yeah, chemical and also mechanical plug control. So when you brush, so we also need the toothpaste to deliver fluoride in our oral cavity, but at the same time, of course, you're removing plug, yeah, mechanically using the toothbrush. So I think we have to advise public to make a smart choice, yeah, make a good choice, what best for their body, for their oral cavity, yeah. And usually in terms of selection of toothpaste, usually the common approach of non-fluoridated toothpaste is actually all this herbal base, yeah, approach, yeah. So actually nowadays a lot of fluoridated toothpaste also have herbal-based ingredients, nature-based. So actually they can, there's a lot of choice. So public can choose based on their preference, but still within our advocacy on the use of fluoridated toothpaste. Right, so this is a bit more like danger or strong accusation that fluoride causes cancer. So I think it was like a few years back, I think there are argument in the social media raised by a very popular figure about, I think, thyroid cancer. Fluoride can cause thyroid cancer and blah, blah, blah. So actually, there's no scientific evidence that indicate fluoride cause cancer. And usually the anti-fluoride group are using a very low quality study, or maybe just from a website that not really, supported by evidence to counter their arguments. So actually, from scientific evidence, there's no evidence to indicate fluoride cause cancer. But of course, there are some side effect related to fluoride, and the only side effect is actually dental fluorosis. So, which is you can see in the photos here, two photos here, the whitish lesion. Yeah. So this is a very much aesthetic concern. So it does not cause pain, does not cause difficulty in eating, and so on. So this is very much aesthetic concern, and it's only happen if it's excessive digestion or ingestion of fluoride at a young age. So that's why there are a lot of guidelines related to supervised brushing, which we can go a bit further later in the next slide. But if you look at data from our country, so actually the prevalence of fluorosis among children live in water fluoridated area is around, because when they have combination of both fluoride from toothpaste and fluoride from the water, so the range of dental fluorosis is between 30%, yeah, 30 to 35%. And the majority are a very mild category like this one, yeah. So this is like almost all teeth, white teeth, yeah, moderate to severe, but most of the condition is actually at a very mild category. So it's something acceptable by the community. In fact, in several studies in Australia, in US, some children, they like it. Yeah, they don't even notice they have this white spot lesion. Of course, we as a dentist, we can spot it, but some of them, it don't really bother them. Then there are treatment to also minimize this. Yeah. So they can do microabrasion and so on. So there are ways to control it. But another issue would be maybe related to skeletal fluorosis, but this one is very rare in our country. I have not seen any case report or anything related to skeletal fluorosis due to fluoride ingestion. Yeah. So usually it's required like 10 to 20 milligram of fluoride intake per day for over 20 years. Then only maybe you can see. But you can see like in our neighboring country, for example, Thailand, because there are population that live in high naturally present of fluoride in the water. It's natural. They don't add fluoride in the water. It's naturally present in their water. So that one is a bit different because they have to go for defluoridation approach because the water is not safe to drink. So that's totally a different story. But sometimes the anti-fluoride group will use this kind of evidence to support their argument, which is totally wrong because that one is totally different. The natural fluoride can go up to 7 parts per million or 10 parts per million, and then the daily intake is not safe, yeah, for the population there. So that's why we have to be very careful when we read articles or arguments from the anti-fluoride group. We should be able to I think answer them and argue them back. Yeah. So especially we have to understand the quality of evidence that they put forward. But I cannot find any paper that say fluoride cause cancer. Yeah. Right. So that's why in relation to the use of fluoride, yeah, for children below 6 years, so we can see a lot of guidelines actually encourage supervised toothbrushing. One of it is to minimize excessive ingestion of fluoridated toothpaste. Yeah. All right, so I put forward here selected guideline from regarding the use of fluoride toothpaste for children. So usually fluorosis, the way that we have to be concerned is when they are very young, age less than 6. So we have to be careful and make sure we supervise our children, yeah, and then make sure the amount of toothpaste is correctly used. So there are countries actually that did not encourage the use of fluoridated toothpaste before they reach 2 years old. Yeah, for example, a few countries like Australia and Ireland, and also Hong Kong, which have water fluoridation in the water. So they actually their guideline is actually no fluoridated toothpaste. So still brush, but without toothpaste. Yeah, still brush. So don't get confused because sometimes my students get confused. They thought brush with non-fluoridated toothpaste. There's no guideline to say that brush with non-fluoridated toothpaste. But what the guidelines say is you can brush without toothpaste. Just brush with water, okay, or just brush. You don't have to put anything. Yeah. But however, in other countries, for example, England, New Zealand, USA, Canada, and Malaysia, we actually say we can use fluoridated toothpaste, but a very small amount, just a smear layer, as soon as the tooth erupt. Yeah, and then some country like Canada, actually, what I forgot to put here, is actually also based on caries risk. So some country are moving toward the advice toward caries risk. If the children have high risk of getting caries, then they will encourage to use toothpaste, fluoridated toothpaste earlier. But if the children have low caries risk, they can start using toothpaste after 2 years and above. Yeah. All right. So another one is after 3 years. Yeah. So there are also guidelines regarding the use of fluoride toothpaste for children between 3 to 6 years. So I think sorry, I've copied the wrong file. So this one is actually the amount is actually P size. Yeah, sorry, I did not copy the correct table. Sorry about that. So it's actually P size. Yeah, P size for 3 to 6 years old. That one is almost consensus lah throughout all the guidelines. So sorry, this is a wrong section. Yeah, age start and amount. It's actually P size. Yeah, P size for 3 to 6 years old. All right. All right, so this is a summary from the guideline that I can extract. So for children below 3 years old, smear or rice grain size, and for 3 to 6 years old is pea size, okay, pea size. And then the recommended fluoride concentration is 1,000 to 1,500. So for adults, actually for children, there are more and more guidelines saying at 1,000 parts per million to 1,500 parts per million. And then there are also guidelines, for example, in Australia that go for slightly lower concentration for children younger than 6 years old, which is 600 parts per million. Yeah. So, but for our country, we go for 1,000 parts per million. So I think this one still kind of like in terms of concentration, there are debate for young children, but the rest for adults and any children more than 6 years old is at 1,000 to 1,500 parts per million. All right. So, and then another keyword is supervised toothbrushing. So we actually encourage supervised toothbrushing for children below 7 years old. So that we want to avoid excessive ingestion during this age. Yeah. And then of course to put a correct amount, because sometimes young children, they need help. So they cannot do themselves, right? So we have to monitor the amount of toothpaste they use and how they brush. Yeah. All right. So actually, when people argue about the use of fluoridated toothpaste, I always say that all these factors are all the use of fluoridated toothpaste are associated with these factors: age, when they start brushing, whether they have been supervised or not, the frequency of brushing, how many times they brush. So of course, the recommended time is twice a day, morning and before bedtime. And then fluoride concentration and amount of toothpaste and duration of brushing. Yeah, the recommended time is 2 minutes for Malaysian guideline, and then also post brushing advice. So actually, more and more evidence say that post brushing advice is actually spit out only. They don't have to rinse, but I think for Malaysian population, there's a bit challenging to advocate for a spit out only. So that's not like culturally accepted. So usually we say if you want to rinse, just rinse once, or no rigorous rinsing. Yeah, so that we want to maintain fluoride at low level in the mouth. All right. So another myth that always sometimes appear is actually fluoride, especially among the Muslim communities, that say fluoride is haram. So actually, there are, I think, a lot of evidence to say that it's not haram. Yeah, it's actually derived from a natural source, and then, in fact, our Zamzam water, our holy water Zamzam, also consists of fluoride. And then, if you look at the data, the concentration of fluoride in the Zamzam water also similar to the range of fluoride recommended by WHO. And then our miswak also contain fluoride or kayu sugi. Yeah. So actually it's very, it's not true. Yeah. When they say fluoride is haram. And then I think more and more company or industry players have put go through halal certificate endorsement. So there are, I think if you go into the market, there are a lot, yeah, actually a lot of toothpaste. I just put some example here. There are more and more brands are actually get halal certified toothpaste. So I think there will be, hopefully there's no more issue of halal, haram toothpaste or haram with fluoride and so on. Yeah, I've came across this. I remember getting, but I didn't take that photograph of the flyers when I was working in Terengganu last time. Yeah, they put it on our car about fluoride is haram and blah blah blah. So very confusing. Yeah, so some group are still using this argument to confuse public. Yeah, right. So I think I'm towards the end of my slide. So I think to conclude, fluoride toothpaste and water fluoridation are safe and is proven effective measure in caries prevention. And there are strong evidence to support the use of fluoride as public health measure for dental caries. And then our guideline on brush twice daily with fluoridated toothpaste and supervised to brushing for young children is still, I think, persists for so many years. So I think as long as we try to comply to this guideline, hopefully we can improve or have status among Malaysian population. And then don't be afraid to drink fluoridated water. In fact, some country that have issues with access to water fluoridation, they actually encourage company to market their bottled water, the bottled water with fluoride, yeah, so that more people can have access to fluoridated water. So there are also countries who use that approach, yeah, because there are issue with their, cannot add fluoride in their water source, but they actually get industry player to come in to actually market bottled water with fluoride or fluoridated bottled water. So that's another approach. But in our country, we are so lucky and fortunate that we have water fluoridation program. So hopefully the program will continue and benefit the population. And don't be afraid to drink fluoridated water. And then I think we have to play our role as dental health professional. We have to debunk the myth about, all these misconception about fluoride. And then I think it's quite worrying to see some of the public that, or sometimes patients that we see in the clinic, when we ask why you don't use water fluoridated toothpaste, they tell you all these misconceptions. So they read on social media, they read from the sources which is not reliable. So actually that affect them, So they are so scared to use for example, for their babies, for young children, so that kind of thing I think should be corrected. The information should be, we hope to deliver correct information to the public, and hopefully it will benefit them for the long run. All right, so these are my list of references. With that, I thank you for your attention.
Thank you, Dr. Noor Azlida, for that informative and enlightening facts and also debunking the myth about the dangers of using fluoridated toothpaste or fluoride in our water system. Yeah. So I think we have heard a lot of strong evidence to support the benefits of water fluoridation as well as the usage of toothpaste, fluoridated toothpaste from our speaker today. I think Dr. Azlida, I'm happy to know that she is one of the experts, yeah, and she was under our department, the juniors, yeah, and who are coming up to be experts in this field, yeah. So I realized that there's no question on the comment section. Maybe Dr. Azlida, can you sort of elaborate a little bit on the water filter? I think it's quite an issue, and you did touch on it, but I think very briefly.
Right. I think I have this discussion with oral health program last time, yeah, when we were called by to be involved with a water conference, yeah. So we've been challenged quite extensively lah by people from the water industry about the what I call the rise of water filters in our country, and most of it is actually shown to actually filter fluoride. because actually this is something I think how to say this, industry players should also help us with this, because after speaking to several other environmental expert, chemists, water quality expert, they actually also worried about the quality of water filters that we actually drink, because some of it, according to the officer that I spoke, who actually evaluate for water quality, that they have do some I think mapping for quality of water from the filtered water, is actually also worrying, because they did not comply to the national water, to a certain extent did not comply to the quality water. So nowadays I think from my research, people actually use water filters not because they want to remove fluoride. So many of them will say because it's convenient. They have cold and hot water. It's very easy for them. And some area have maybe poor quality water, so they feel if they filter it, so that they get a better quality water and things like that. So whether this issue actually we know as a threat to our water fluoridation program, but I still believe the program is still benefited our those from low income group, or those who have not filtered their water, because majority of those with water filters are actually among the high income group and the urban area, who also maybe have better oral health compared to those who actually did not have access to water filters. But maybe, I don't know, this is something always come to my mind. Maybe I think if we have a water industrial player that can actually come out with a system that selective filtration, because we don't want they filter everything, right? Nothing, like zero minerals in our water. So maybe they can do like selective ion or whatever, selective filtration, so that they can filter things that are not good for our body, but they can maintain good ion and minerals for our body. So including fluoride. So I think hopefully, according to the discussion, I think at the Water Fluoride Conference, I think they're also actually now looking at the quality of water for after water being filtered, because actually there's a lot of amount of work and effort done by people from the water board to ensure the quality of water. But eventually, if people are using water filters, whether the water that they actually drink comply to the national water quality is still questionable, because they are still doing the mapping lah, to see is there any dangerous element in there, because I think according to some of the pilot study that they did, actually, especially if we did not service the filters, there are actually ada macam dangerous item lah, macam leaking from the, if they have leakage from the filtration system, there's something going on in the water actually that may cause harm to the body, but they're still not published it yet. But hopefully, I think if we have that evidence, that can actually help lah, to, I hope, to convince the industry player to also play their role in improving their water filtration system. But I think in one hand, people like it because it's convenient, but whether the quality of water that we receive same as what they claim is also questionable actually, kan, sebab there's no evidence kan, it's mostly marketing. So hopefully, if our team from water quality are doing excessive study on that, and because I said what I heard, there are a few people, researcher from UTHM and UTM, they are looking into pushing forward agenda for national guideline for water quality of water, filtered water. So now they have now we have guideline for quality of pipe water, but now the agenda is they're going to put forward national standard or national indicators for filtered tap water. So I hope if that can be, the agenda is being put through, hopefully there will be, I would say, evidence lah for our industry player to help us with this as well.
Thank you, Dr. Noazrida. There is one question related to the water filter. Dr. Ma'an, do we still have time?
Yeah, okay, Prof. Maybe 5 to 10 minutes, Prof. Because there's
Yeah,
two questions from Dr. Badrul Munir and Dr.
yeah,
Savitri. I
yeah.
appreciate
I
if
missed.
Prof. Zeda can answer before.
Can you see the question, Dr.
Yeah.
Azlida?
Actually, from
Ah,
Dr. Badro Munir. Hi, Dr. Badro. I think this is postgraduate from UITM. Okay, is there any enough research on water filter in Malaysia, in your opinion? Because there are numerous companies selling the combination of filters that keep changing in the market. So I think one of it is actually Prof. Budi, right? Prof. Budi from UITM. I know she and her team are doing also doing studies on water filters. But I'm not sure extensiveness of the I think what we did from the dental side more on like how many water filters and whether they actually filter fluoride or not. But whether the water quality part, I think we really need people from chemistry, from environmentalists, and the water engineers that usually involved in water quality study. So they can help us to do the other indicators. Then I think the agenda will be stronger lah to put forward to the industry player to show evidence, because we cannot just show evidence on fluoride. I think we should also look at other indicators of water qualities. Then only we can convince them that you have to do or, or, or come out or be more innovative in terms of the types of filters that the technology of filtration itself. But I believe if they can do something like ozone filtration and things like that, I hope they can take up the challenge of doing a selective filtration lah. I think hopefully if that's um, something that we can hope for the future, because this one really require support from industry players themselves. But if there's no guideline, they can market whatever they want. If there's nothing to say that you cannot do this, cannot do that. So for now it's open market. So of course they keep changing, selling combination of filters. And if you notice, their market will be like something that I always observe is ozone, right? Ozone lah, something like I never heard about. So I think they should market their products on what benefits the population. Maybe they can say, oh, this one is selective water filters that did not filter fluoride, something like that. We want that kind of marketing, not something that like claim marketing, but not sure whether that's going to be beneficial to the population.
Dr. Azlida, the question, next question is from Dr. Savitri.
I cannot see Dr. Savitri, but I can see Dr. Nawal comments here.
Oh, yeah. Dr. Nawal has commented on your about you answer previous question. You say, yeah, household that can afford water filters might have an abundance of sugary snacks, so the brushing part is most important. Fluoride is still desperately needed by the poor. Thanks, Dr. Nawal.
Thank
for
you, Dr.
comments.
Nawal, for the comments.
There are two questions from Dr. Savitri. What would you recommend for professionally applied fluorides based on new evidence?
Okay, for fluoride varnish, is it? Is it fluoride varnish?
She also asked about, I think she mentioned about fluoride varnish. Her other question, how does the remineralization induced by chlorhexidine compare to that afforded by fluoride varnish? I would like you to comment about fluoride varnish, please. Yes.
Varnish, we still, for fluoride varnish. So I think there are evidence to say that it's either you do twice a year or 4 times a year, depending on the patient's risk. So the minimum is actually you have to do it at least twice for fluoride varnish. So it's either 6 monthly or quarterly lah, if it's a 4 years, 4 times application. So I think that's that's the current recommendation. I think from AAPD and a few other guidelines. Second question is second question is what?
This one, Prof, I displayed. How does the remineralization induced by chlorhexidine compare to that offered by fluoride varnish?
Oh, sorry, I don't know this. I cannot answer. I'm not quite sure about this, so I don't have the information. Sorry, Dr. Savitri, on this.
Okay. Thank you so much. I think we're already 5 minutes past 11. Thank you so much, Dr. Azlida, Associate Prof. Dr. Azlida from University Malaya, for your support to Masa University and help us by conducting this webinar. Any words of thanks, Prof. Rashida?
Yes, thank you, Dr. Azlida. I think you have got a lot of comments from our viewers here, and there are quite a number of viewers, and I hope they will continue to view those who are not able to be with us this morning. Thank you so much, Dr. Azlida, and we want to see you. She will come as our external examiner this year. So I hope the students have benefited from this webinar. Thank you.
Thank you so much again for the invitation, and thank you so much, Dr. Rashida, one of a great teacher of mine when I was undergraduate, and then when I was in UM. It's great to be working with you again. So thank you so much for Masa University as well for this opportunity, and thank you for those who are watching and give good comments as well.
Yeah, thank you so much, Prof. The links will be on Masa University Facebook page, Faculty of Dentistry, Masa University Facebook page, and Masa University YouTube channel. So people can still looking at the webinar recorded there. For any question, Prof. Rashida may contact you, so we can give them the answer in the social media. Thank you so much. Great thanks, Associate Prof. Dr. Noor Azlida, for the informative webinar and her up-to-date information about the fluoridation in dentistry in Malaysia. I'm Dr. Ma'an Al-Marzouk, the coordinator of webinar series in Masa University Faculty of Dentistry. Thank you so much for our audience for their kind attention. Please stay tuned in our social media for announcements about the future webinars. Thank you so much and have a nice day. Thank you so much, professors. Thank you, Prof. Rashida. Thank you, Prof. Zida. Have a nice day.